Laugh it out. Just laugh it out. I got 45 minutes. Just laugh it out.
It's nice.
Okay. Are you good?
It's not funny.
Alright. Hi, my name is Andy. I'll be doing your head-to-toe exam today, and I'm going to be your nurse. Alright? How are you feeling today?
I'm good.
Feeling good? Alright. I'm going to go ahead. I'm going to either close the door or pull the curtains to provide privacy, whichever is appropriate. And I'm going to go ahead, wash my hands, put on gloves. So can you go ahead and tell me your name and date of birth?
Jonathan Schwartz, 03/30/1994.
Okay, Jonathan. And I'm going to go ahead and I'm going to check that to his hospital bracelet to make sure that's accurate. Do you know where you are today?
Yes, I'm at the hospital.
Do you know why we're here today?
Getting my head-to-toe assessment.
And do you know what the day and time is?
12:01, and it is 5:15.
Okay, so my patient is alert and oriented ×4, even though he just cheated a little bit on his watch, to check the time. But he did know the date, he did know his person, he knew why he was here, and he knew the place. He also has spontaneous eye movements, and he's able to obey verbal commands. And since he is alert and oriented ×4 on the Glasgow Coma scale, he would score 15. Do you have any allergies at this? Do you have any allergies? Any allergies to medication or the environment? Any latex allergies?
No.
And no food allergies?
No.
All right, so he has no allergies, so go ahead and document that. Now, looking at his physical appearance and body structure, he is symmetrical. His musculature and bone structures, as of right now, I don't see any deformities. His posture is erect. His skin color and skin pigment is even across and is consistent with his ethnicity and race. He doesn't appear to be in any pain or distress at this time. As well, I don't see any assistive devices, any prosthetics, and his height and weight is adequate for his age. Are you currently in any pain at this time?
No, ma'am.
On a scale of 0 to 10, or on a scale of 1 to 10, 1 being no pain at all, 10 being the worst pain of your life, where would you rate your pain?
1.
All right. Let me just think really quick. All right. So now we're going to move on to the HEENT part of the exam. And I'm going to start that off by just asking him a few questions about his head and throat. So, do you have any headaches?
No, ma'am.
No headaches. Do you have any pain in your throat?
No.
Any pain in your head?
No, ma'am.
Okay. Have you had any sore throats recently?
No, ma'am.
No. All right. Have you had any changes in your vision?
No, ma'am.
Any changes in your hearing?
No, ma'am.
Any changes in your sense of smell? What about changes in taste?
Nope.
Difficulty chewing?
Nope.
Any difficulty swallowing?
No, ma'am.
Have you had drainage from your nose?
Nope.
Drainage from your eyes?
Nope.
Any drainage from your ears? And again, no sore throats?
No.
Yeah, have you had any sores in your mouth appearing?
Mm-mm.
Okay, so he checks out subjectively with no pain or any kind of deformities going on that he has noticed in particular. Now I'm just going to do a general inspection of his head. So by looking at his head, I do see one nose, I see 2 eyes, I see lips, 2 eyebrows, 2 ears. So just looking at his head is normocephalic. Hair is evenly distributed across his face. His bone structure is adequate. His skin, I'm just going to touch you about this, is warm, dry, and smooth to the touch. And again, his pigmentation across his face is equal across. And I'm going to go ahead now and I'm going to palpate his scalp. As I'm palpating his scalp, let me know if you have any tenderness, okay? I'm looking for any lumps, lesions, deformities, any excessive dryness, infestations, as well I'm checking his hair distribution, which again is good. Good job. And now after palpating his scalp, I'm going to go ahead and I'm going to palpate his sinuses, starting with his frontal sinus, moving down to his maxillary sinus. Did you have any pain or tenderness with that?
No.
Okay. And now I'm going to go ahead and palpate his temporal pulse. Okay, I'm checking and I'm seeing that they're equal bilaterally, they're regular and even, and I would grade them as a +2. We're going to move down to his TMJ. Can you open and close your jaw for me? Did you have any pain or tenderness with that?
Nope.
Yeah, patient reports no pain or tenderness when opening and closing his jaw, and I didn't feel any clicking at the TMJ. So now I'm going to go ahead and I'm going to see, I'm going to look at his lymph nodes and palpate them and see if there's any palpable lymph nodes or masses noticed, or he will let me know if there's any tenderness. And we'll start at the pre-auricle, work our way up to the post-auricle. Then we're going to go to the submandibular, the submental. I'm going to go all the way back to the occipital. Do you have any pain or tenderness with this?
No, man.
All right. Then we're going to go to the superficial clavicle chain, the deep clavicle chain, or deep cervical chain, sorry. Superficial cervical chain, deep cervical chain, and the posterior cervical chain. And at this time, I'd also check his supraclavicular lymph nodes. I'm not going to get close to him. He broke his clavicle when he was a little kid, so he just has this weird thing where if anybody touches his clavicle, he twitches. But I would palpate it here. If he had an issue, I'd use his hands to help him touch it at this moment. So now, did you have any tenderness with that? And I didn't feel any palpable lymph nodes with that. So we're going to go ahead and I'm going to go on to looking into his eyes. At first inspection of his eyes, he has two eyebrows bilaterally and they're moving symmetrically. I don't see any protrusions with his eyes, any edema or swelling. His eyelids close and they overlap correctly, and his eyelashes are even across his eyelids. And then just looking at his structure of his eyes, I'm seeing that his pupils right now are round and they're equal bilaterally. His irises are a nice blue-green color, and they're equal bilaterally and round as well. His cornea is clear. Can you pull down on your face for me? His conjunctiva is pink and moist, and his sclera is white, and I can see the presence of the vessels. So we're doing good so far. Just kidding. So now we're going to go ahead and I'm going to do a few more inspections of his eyes. So again, we touched on some of the structure of his eyes, but now I'm just going to look at his pupils' reactivity. So all I'm going to do is shine this nice bright light in your eye, all right? Mm-hmm. All right, ready? There we go. There we go. So his pupils, again, are equal, round, and reactive to light, and I'm going to check to see if they accommodate. So I'm going to have you look back there, and when I tell you to look forward, you're going to look at the tip of the pen, okay? Ready? So look at the back. Okay, look back. Look at the tip of the pen. Look back. Look at the tip of the pen. Okay, so his pupils do accommodate, and I'm able to tell this by the way they constrict and converge when he looks at the tip of the pen. Now I'm going to go ahead, and I'm going to test his 6 cardinal fields of vision. And basically with this test, it's going to test cranial nerves 3, 4, and 6. And I'm looking for any EOM dysfunction, okay? So just follow the tip of the pen, ready? One more for good luck. All right, awesome. And now we're going to go ahead and check his peripheral vision. So he's going to cover the opposite eye of me, which would be that hand to that eye. I'm going to do the same thing. Just let me know when my fingers come into your field of vision, okay?
Mm-hmm. I can see.
Okay.
I can see.
All right. And let's do it this way. Ready?
I can see.
Okay.
I can see.
All right. So his peripheral vision is good. Then at this time, if I had an ophthalmoscope, which I do not, I would look more into the internal structure of his eyes. I'd be checking the red reflex to make sure that is equal bilaterally. I would look at his optical disc margins to make sure that they are round and have sharp margins. I would look at his retinal background to make sure it has an even colors. Same with the macula, that it has an even colors. I would look for no hemorrhages or exudate as well with the ophthalmoscope. And that would end looking at his internal structure of the eye. From there, we would also, if he was over 40, I would do a near vision test. That's when I have a handheld vision screener. We sit about 14 inches apart, and it has lines that go up and down with varying sizes of letters. And basically, at 40 years old, you're checking their nearsighted vision, and you're making sure that they can read that chart from 14 inches away without having to lean closer or without hesitancy. So if they can pass that at 14 and 14, that's a normal limit. We also have the Snellen chart, which I do have here. And again, Snellen chart, you position them 20 feet away, and this is for anybody. And he would read down the lines to the farthest that he can go. Wherever he lands, I look at the fraction that he lands on with the last line he's able to read. The top number is how far away he is standing, which would be 20 feet. And the bottom number is where the normal eye can read that number at. So normal vision test that we're aiming for in the Snellen chart is 20/20. All right? So, and you haven't had any changes in your visions at all, correct? Okay. All right, so now we're gonna go ahead and I'm gonna move on to his nice symmetric nose. So again, his nose is symmetric. Right now, I don't see any drainage. I'm gonna go ahead and I'm gonna look in to his nose really fast. All right, so I see a little bit of hair, which is normal, but I don't see any drainage, no ulcers, no tumors, no polyps, no lesions or deformities, no septal deviation, no occlusions. Are you feeling congested at all? How do you run your nose? Okay. All right, now we're gonna go ahead and test his patency in his nose. So what you're gonna do is you're gonna cover one nostril with one finger, push down on it, take a breath in. Okay, nice and clear. And then can you do it the other way? All right, nice and clear. How did that feel?
Good.
Okay, so there's no septal deviations and his nostrils are patent. So moving on from there, and just to go back to looking at his face, I want to say I didn't notice any involuntary movements in his face. As well, I didn't see any suspicious nevi. He has a few macros scattered across his face, but that's about it. All right, sorry. Now going back to the nose, if I can do this properly, I have this little K-cup with coffee grinds. So this is going to test for cranial nerves 1, which is smelling. So I'd have him smell this, and he would let me know, what does that smell like?
Coffee grinds.
All right, so now I know that cranial nerve number 1 is intact. As well, I want to say, just bouncing back, when I checked his eyes, I checked for cranial nerves 3, 4, and 6, and the last few tests let me know that cranial nerve number 2 was working as well. Okay, so now we're going to go ahead and move on to his ears. So first, I'm going to look at the 3 external structures of his ears. So I'm looking at the tragus, the mastoid, and the auricle. And I'm looking at them on both sides. They are symmetric on both sides. The color is even on both sides. I don't notice any breaks in the skin integrity. I don't notice any deformities or lesions. He doesn't have any piercings. There's no macules or anything on his ears. Do you have any pain on the outer structure of your ears? You haven't noticed any tenderness?
No, ma'am.
Okay, so I'm going to go ahead now and I'm going to palpate his external structures of his ears just to check that. So let me know if you have any pain or tenderness. Okay, you have any pain or tenderness with that?
No, ma'am.
So patient reports no pain or tenderness on palpation of his ears, and again, I didn't see any skin integrity or any types of deformities that would be of concern. Now at this point in the test, if I had an otoscope, I would look at the inner structure of his ears, and we would do that with, again, an otoscope. And you hold the otoscope upside down, we look inside both sides of his ears. Like he's reporting everything normal. If it was normal, I would see a pearly gray tympanic membrane. And I also would look at the inner canal, and I would see no protrusions, I would see the landmarks in place, I would see no swelling, no redness, no drainage or serum, and no foreign bodies as well. I'd also see the light, the cone of light reflecting at 7 in the left ear and at 5 in the right ear. All right. So that would end for the otoscope, and then we would move on to doing a whisper test in his ears. we would move on to doing a whisper test in the ears, which I would have him block the opposite ear that I'm going to whisper, and I'm going to whisper 3 words, and he's going to repeat them. Ready?
Red, blue, yellow.
All right, good job. All right, same thing. Ready?
Red, blue, pink.
All right. So with the hearing test done, I know my patient is hearing well, and that will let me know that cranial nerve number 8 is intact and is working. Okay, and that will end it for the ears. Now we're gonna go ahead and move on to his lips. So just looking at his lips, they're nice and pink and moist. I don't see any breaks in the skin integrity, any cracks, or anything that should be a concern. Can you go ahead and give me a big smile, move your eyebrows up? All right, can you frown? All right, so him moving his mouth and moving his nose, I know that cranial nerve number 7 is in fact intact. All right, so now we're gonna go ahead and look at his dentition, which is his teeth. So can you give me a nice smile? Open your mouth real quick. You can close your mouth. All right, so when he did that, I saw that his teeth are white and straight in good repair. There's no malalignment, and I didn't notice any hardware at this time as well. So now can you go ahead, stick out your tongue, say ah. All right, put your tongue up to the roof of your mouth. All right, and then one more time, stick your tongue out, move it side to side for me. By his tongue movements, I know that cranial nerve number 12 is intact. By looking in his mouth, I saw that the uvula moved in midline with the soft palate. I noticed the pharyngeal wall was that pink and moist color. His gums and buccal mucosa were also a pink and moist. His hard palate and soft palate were a whitish pink color, which they should be, and moist as well. And there's no deformities or lesions were noticed. His tongue on the dorsal surface was rough, which it should be. The ventral surface of his tongue was smooth. The veins were also present, and there was saliva present. And his tongue is also that nice pink color, where we want to be at. I also saw his tonsils as well, and I would grade his tonsils a +1 at this moment. You haven't had any pain in your tonsils or anything? Okay. And again, I didn't notice any deformities or abnormalities that would be a concern at this point. Now I'm going to go ahead and move on to checking his carotid pulse, one at a time. Okay. Okay, so his carotid pulse is present bilaterally. I can't say symmetrical because I can't compare it, but it's present bilaterally. It is equal. It is going at a good rate. I would give it a +2. Then we're going to go ahead and look at his range of motion in his neck. Can you move your chin to your chest for me? Can you look up at the ceiling? All right. Can you move your ear to your shoulder? Other side, ear to your shoulder. All right. And then can you just turn your head? Turn your head. Okay. And now I'm going to give you a little test. Can you turn your head against my hand? Okay. Can you turn your head against my hand? Can you push up against my shoulders? All right. So I grade his strength in his neck. He has full range of motion of his neck. His strength in his neck and shoulders, I grade them as a 5. The strength test I just did on his neck and shoulders also let me know that cranial nerve number 11 is in fact intact. And before we finish his head and neck, I'm going to do a sensation test in his face. And so this is going to be soft. This is going to be sharp, okay? Ready? Close your eyes.
Soft.
Okay.
Sharp. Soft. Sharp. Soft. Sharp.
So cranial nerve number 5 is intact because he was able to identify his sensations in his face. And before I move on, I want to say, because his uvula was moving in midline, I know that cranial nerve number 9 is in fact intact. And then I would be able to test for cranial nerves 9 and 10 as well by using this tongue depressor to check for a gag reflex. So the uvula moving up and down in midline lets me know that his swallowing is in fact intact. Okay? So that would be the head and neck. And now I'm going to move on to his thorax region. And we would start that by asking some subjective questions. Have you had any difficulty breathing?
Nope.
No difficulty breathing. All right. Have you had any difficulty breathing laying down?
Nope.
Difficulty breathing on exertion?
Nope.
Have you had a cough?
Nope.
Have you, when you do cough, do you have any sputum come up?
Nope.
Do you hear any wheezing or snoring when you breathe?
Nope.
Okay. Do you ever feel any tightness in your chest? Any palpitations?
Nope.
Do you ever feel your heart racing?
Nope.
Do you ever feel like your heart skips a beat?
Nope.
Okay. Do you feel any tightness in your chest on exertion or
Nope.
pain in your chest?
Nope.
Okay. So he answers this question good, and I don't have anything to be concerned of as of right now. So we're gonna go ahead, and now I'm gonna just inspect his chest. So I don't see him having any difficulty breathing. His musculature and bone structure is equal bilaterally and adequate. I don't notice any masses, lesions, protrusions, any deformities in his chest. His hair is equally distributed. His chest is symmetrical. I would give it an AP ratio of 1 to 2. There's no barrel chest. He's not using any accessory muscles to breathe as of right now. And his chest is just nice and easily falling. If I watch his chest for 30 seconds, because I don't see any abnormalities right now, I would get a respiratory rate of 16, which is in normal range. If I did find abnormalities, like he was breathing weird, we were hearing some sounds, I would listen to it for a minute. But 16 is a good rate, and it's equal, it is rhythmic, and it is following in pretty normal pattern as of right now. So we will move on to a quick inspection. So I'm going to check his skin turgor right under his clavicle bone. Okay, so his skin turgor is good. There was no tenting, which lets me know that he's not dehydrated. And now I'm going to go ahead and I'm going to check his heart sounds. So I'm going to listen to the 4 valves and at Erb's point. I'm going to listen to the diaphragm. So to do this, I am going to go find his sternal notch, and I'm going to go to the second intercostal space right of the sternal notch, and that is where I'm going to listen to the aortic valve. Okay. All right, now I'm going to listen to the pulmonic valve. Now I'm going to listen at Erb's point for 30 seconds. Okay. Then I'm going to move on to his tricuspid valve. And then his mitral valve. Okay, so by listening to his valves, S1 and S2 are present. There was no gallops, there was no murmurs, and as well, there's no gallops, no murmurs, and there's no valvular clicks, which is awesome. At Erb's point, I was looking for an apical pulse, and his rate was regular. He had a good rhythm, and I would give his pulse. I listened for 30 seconds, so it was 34. You times that by 2, and that would give me a pulse of 68, whereas a number where you want to be at, so that's a good heart rate. Yeah, be proud. So as of right now with the heart, there's really not much to be concerned about. And we're going to go ahead and move on to listening to his lung sounds. All right, so with his lung sounds, I'm going to listen anteriorly, posteriorly, and laterally. And what we do is we listen to the bronchial sounds, bronchiovascular sounds, and vascular sounds, which would be the lower half. Okay, so I'm going to listen to 2 bronchial sounds right here, kind of in your lower part of your neck, okay? listening with the diaphragm. Okay, take a breath in. Okay, take a breath in. Okay. Now I'm going to use your sternal notch. Can you take a breath in? Take a breath in. Okay. Can you take a breath in? Take a breath in. Okay. Can you take a breath in? Take a breath in. Okay. And then can you take a breath in? Can you take a breath in? Okay. And now I'm going to listen to him laterally. Can you take a breath in? Take another breath in. Alright, and another side laterally. Alright, so far so clear. Can you sit up for me? And can you just turn your back slightly towards the camera? Alright, now we're going to check for his lung sounds posteriorly, and I'm just going to do this in 4 spots. So, ready? Take a breath in. Okay, take a breath in. Take a breath in. Okay, take a breath in. Okay. So his lung sounds are clear. There's no adventitious sounds were heard, which is where we want to be. And again, heart sounds good, has a regular rate of 68. His respiratory rate was good at 16 with no accessory muscles being used. He was breathing easily. And with a good pattern and a normal pattern and rhythm, which we want to be. So now I'm going to go ahead and we will move on to listening or to inspecting his abdominal cavity or abdominal. So can you go? Well, I'll ask you a few questions first before I do. So, can you tell me have you had any pain in your abdomen recently? Okay. No abnormalities you've noticed? How many bowel movements do you have generally?
2.
Is that normal for you?
Yeah.
Okay. Have you noticed any, differences with the consistency, odor, or color?
Nope.
Okay. Do you have any pain when you go to the bathroom?
No.
Okay. And do you have any urgency to go to the bathroom or hesitancy? Okay. So what about when you need to urinate? How often are you urinating?
4 to 5 times a day.
Is that normal for you?
Yes.
Okay. You drinking lots of water?
Yes.
All right. Do you have any hesitancy or weakness in your stream?
Nope.
Do you feel like you're fully urinating? Okay. Have you noticed any weird odors, color, or consistency when you urinate? All right. And do you feel nauseous ever?
No.
And how's your appetite?
Good.
Okay. Awesome. So let's go ahead and let's have you lay down so I can inspect your abdominal. Okay. So by looking at his abdomen, I'm seeing no pulsations. I'm seeing hair distributed accurately and across his body. His skin pigment is even for his race and ethnicity across his abdomen, and his skin pigmentation across his chest as well. I didn't notice any breaks in the skin integrity. His contour of his abdomen is slightly rounded. It's after Thanksgiving, but that's okay. His abdomen is symmetric, and I don't see any masses or unusual deformities or bulges or anything that I should be aware of or that should alert me to anything. You haven't had any pain or tenderness again in your abdomen? Okay. So his abdomen on inspection checks out good. Now I'm going to go ahead and I'm going to listen to bruise in his abdomen. And I'll listen to bruise with the bell, starting with the abdominal aorta and landmark. Okay, now I'm going to listen to his renal arteries. And I'm going to listen to the Okay, so no bruise or notice in his renal or abdominal aorta, his renal arteries or abdominal aorta. So now I'm going to go ahead and I'm going to listen. I'm going to oscillate his abdominal sounds now with the diaphragm, and I'm going to do that in all 4 quadrants, starting in the right lower quadrant because that is where bowel sounds are most active. So we're just going to go ahead and listen. Okay. Okay. All right. All right. So there's abdominal sounds present in all 4 quadrants. I would say they are normal active, and they are present as well, and then they're regular. So doing pretty good so far. So now we're gonna go ahead and move on to doing a light palpation of an abdomen. So let me know if you have any tenderness, and I'm just looking for masses as I do this. Take lunch at all? Okay. Do you have any mass or tenderness? Okay. So now, that was a light palpation. I'm going to do a deeper palpation again. Let me know if there's any masses or tenderness. Any pain? Okay. So he didn't have any pain, and I didn't feel any masses on deep palpation. So we are now going to go ahead and I am going to percuss his abdomen in all 4 quadrants, and I'm looking to see if anything, I'm making sure it's tympanic. Okay, so his abdomen is tympanic, where we want it to be. And did you have any pain or tenderness when I did that either? Okay. So we're going to go ahead now and move on to assessing his upper extremities and lower extremities. So you can go ahead and sit back up. Be comfortable.
Thank you.
You feeling okay?
Yeah.
Okay. So awesome. So we're going to do some subjective data, and this subjective data is going to be aimed at his upper and lower extremities. So have you had any weakness you noticed in your arms or hands? What about your legs or feet? Any changes in sensation in your arms or hands? What about your legs or feet? Have you had any changes to your range of motion in your arms or hands? What about your legs or feet?
No.
Okay, so everything's working good. And again, no pain in your arms or hands, no pain in your legs or feet. Okay. So now just looking at him subjectively, again, you're gonna look at his skin, a few macules are spread, but no suspicious nevi. I'm gonna check his temperature. In his arms, it's equal bilaterally. In his legs, the temperature is equal bilaterally going down. I will check his brachial pulse. It is present bilaterally equal, and I would give it a +2 rating. I'm going to check his radial pulse. It is present bilaterally equal, and I would give it a rating of 2+, same as the brachial, 2+. I'm also on inspection, I'm noticing that his extremities are symmetric. The musculature shape and size and bone structure is symmetric and adequate as well. And I'm not noticing any breaks in the skin lesion, deformity, break in skin integrity, deformities or lesions. In his legs, I don't notice any venous or arterial lesions as well, which is what we want. And there's also no edema or swelling in his arms or legs. So we checked your pulse, temperature. Now we're gonna go ahead and we're gonna go here, slide on down, and I wanna look at your nails, okay? So your nail beds are that nice pink color, which we want to be. There's no clubbing. Their nail beds are hard, they're shiny, and they're the correct shape that we want them to be in all hands. All right, I'm gonna go ahead. His nails, or his fingers as well, are warm to the touch bilaterally, which we want them to be that correct temperature, and they are dry as well and smooth. So now I'm gonna go ahead and check his cap refill in all fingers. So as I'm seeing, his cap refill is less than 3 seconds, which is where we want it to be at. Can you go ahead and grip my fingers real tight? Okay. Then can you pull me forward? Can you push on me? Okay, so I give his grip strength a 5 out of 5 and his upper extremity strength with that push and pull test a 5 out of 5 as well, which is where we want it to be. Again, now we're going to move down to testing his lower extremities. I'm going to check for edema in his tibia. There's no edema. I would check for tenderness in his calf. Can you let me know if you have any tenderness in this? There's no tenderness bilaterally in his calf. I'm going to check his dorsalis pedis pulse, the top of his foot. It is present bilaterally. I would give it a 2+, and they're equal. All right, then I'm going to check his posterior tibia pedis pulse, which is present bilaterally, equal, and I would give it a +2 as well. All right, now since we're at his nails on his feet, they are pink. They are nice, hard, and shiny. I don't notice any clubbing. His toes are warm, and they're equal. The temperature is equal across. There's a little bit of hair on his toes, but that is fine. I'm going to check his, there's no clubbing. I'm going to check his cap refill and his nails on his toes. Again, I'm checking to make sure that it's less than 3 seconds. So his cap refill on his toes is, in fact, less than 3 seconds, which is where we want it to be. And now I'm going to check his push-pull reflex. So can you push down on my hands? Can you pull up on my hands? All right, so I give his push-pull reflex in his lower extremities a 5 out of 5, where we do want it to be. So now can you go ahead and stand up for me? One part of the test. All right, do you have enough space?
Yes.
Okay, so you are gonna put your hands up. You can just look forward at the camera. And then put them back. Okay, and then can you turn towards the camera? So down by your side, up. And can you cross them? And can we cross again? Awesome. And then can you come back down? And now your favorite one, John, go ahead. You can make a muscle. And then relax. Okay, bring it here. And you're going to go up like you're holding soup. Turn it over as far as you can. Okay, and then can you bring your elbows in and do that again? Okay, good. And basically what we're doing is we're checking his range of motion in his shoulders, his elbows, his wrists, and his fingers. So now we're going to get to his wrist. So now can you turn your wrist in? Can you turn your wrist out? Can you turn your wrist down? Flap them up. Okay, and then can you bend out your fingers? Open up at your fingers. Can you bring your fingers up? Can you open and close your fingers like this? Okay, and then can you make a tight fist? Open. Okay, and then you can bend out your fingers, right? All right, good. So he has full range of motion in his upper extremities. Did you have any pain or tenderness, any weakness and sensation with that? Okay, awesome. Now we're going to check his lower extremities. So once again, follow me. Straight leg. We're going to kick out, kick back. Can you do that with the other leg? Kick out, kick back. Okay, and then you're going to bring your leg out and then across. Okay, same thing with this one. Out and then across. Awesome. And now you're going to bring your knee up, kick out, bring your knee up, kick out. I feel like we're doing like a workout class. Can you bring your knee up, turn your hip in, you can put it down, up, turn your hip in, and you can put it down. Okay, so that's good. Now can you go ahead and we'll sit down, I'll check your ankles. All right, now can you pull up again? Can you push down again? Can you turn your ankles in? Can you turn your ankles out? So he has full range of motion in his ankles, and then can you scrunch your toes up? Can you spread them out? Can you spread your toes out? And bring them together. Okay, so he has full range of motion in all his lower extremities. We're checking his toes, which is his pharyngeals, his ankles, his knees, and his hips. Full range of motion. Do you have any pain or tenderness with that? Okay. So now we're going to go ahead, and I'm going to look at his spine. Or actually, go ahead and stand up for me real fast. Can you walk forward? Can you walk back? So his posture is erect. He's balanced. I don't notice any. He has a normal arm swing, and he was balanced as well. So that's what we want. We go ahead and we're gonna look, or actually, can you turn around for me? Okay, so by looking at him, his postures are, okay. Can you walk heel to toe for me? We're just looking at his balance. Okay, that's good there. So he's balanced by walking heel to toe. Okay, can you stop there? Can you put your feet together? We're gonna do the Romberg test. Close your eyes, hands out to your side. Okay, so patient's balanced and passes the Romberg test. Now we're gonna look at his spine. So looking at his spine curvature, we're looking at the cervical, the thorax, the lumbar, and the sacral. They're convex, it's an S shape, normal S shape pattern where we want it to be. It is concaved here and at the sacral, so at the thorax and the sacral. Sorry, it's convex at the thorax and sacral and concaved at the lumbar and cervical, which we want. Can you go ahead and bend forward for me? I'm going to check his spine. I don't see any scoliosis. His spine is straight. I also didn't notice any kyphosis or lordosis. Can you go ahead and bend back up? Can you bend backwards a little bit? Can you twist to the side? Can you twist to the side? Can you go like this, motion, go like this, motion, other side. Do you have any pains or limitations with that?
No.
Nope. Okay. Go ahead and sit back down. Last test we're going to do, we're going to test his deep tendon reflex. I would normally have a hammer, but I don't have one, so we're just going to grade it, see? Okay. So his deep tendon reflex, I would give a +2 and equal bilateral, what we wanted to do. Now I'm going to have my patient lay back down in the bed. I would put him in a safe situation, put the bed down, make sure the call light was near, and anything he needed. I would also put the rails up as needed. I would offer myself to him by asking if there's anything else I can do for you. If there's nothing else I can do, he's in a safe situation. I would wash my hands, or take off my gloves, wash my hands, go ahead, document everything I found, and that would end my exam.